The other side of the line, pair our healthcare call centers report, 39% of contact center leaders pointed to staff burnout, turnover, and shortages as the main drivers of their call centers' inefficiencies. 74% of leaders report feeling pressured to demonstrate their call center is not a cost center. And 43% of their budget is sunk into labor costs such as training, hiring, and retaining staff. So we found these glaring friction points. So we decided to ask patients, what exactly are they looking for? Or more precisely, how can health providers make patient access easier? 80% of patients believe that there should be more self-service options for scheduling appointments. 62% would prefer to self-serve rather than call to refill their prescriptions. Then we asked them about their perceptions of AI as a tool to amplify access for patient access. So 66% of patients expect their healthcare providers to adopt generative AI for better online and phone support this year. 84% of patients would rather speak to an AI assistant rather than wait on hold. And we asked them about their concerns in regards to AI in patient-facing work, and 33% identified the privacy and security of their personal health information as their top concern about the use of AI in healthcare. Okay, so now to our panel discussion. That was a lot of information, a lot of stats. Mona, Jim, did anything in particular jump out to you? And now that that you can see the presentation, I can scroll back. But did any one of these statistics really jump out at you? And if so, why?
I think for me, the stat just around the stat, there were two stats, I think, if I got them correctly. 23% of patients choose not to cancel their appointments because of those long hold times, and 23% failing to cancel their appointments because there's no online option. I was really surprised that there are so many no-shows that are attributed to it just being too hard to cancel. It actually made me really sad to see that. And, I think when we think about self-service options, I think we automatically go to, how can we improve access? How can we give people easy ways to make that appointment? But I don't think we've really thought through what happens afterward. And with many health systems, struggling with capacity, a no-show is a really bad thing, for the health system and also for other patients who would like to be seen sooner. So to me, that was the most surprising thing, and I feel like it can be easily addressed.
Jim?
I also have two of them that surprised me. The one is 21% of patients delay or forego refilling prescriptions due to lengthy hold times and cumbersome refill processes. And the second one is the 62% would prefer to self-serve rather than call to refill their prescriptions. And I'm surprised actually that these numbers are not higher. And I say that because in our call centers, we get quite a bit of calls for prescriptions. And of our non-scheduling calls, they probably equate to about 20% of the volume of calls. And so it's a lot. And so I have to remember that you surveyed 1,500 people out there, and if you continue to survey various places around the nation, you might find it to be a bit higher, actually.
Sure. I think that for me, right, and conducting the survey and being really close to these stats, here, let me pull this up. I think what really stunned me was that 32% of patients reported that they had health setbacks as a result. I think that we always think about patient access sort of possibly in the realms of patient experience and patient satisfaction, but seeing it come into sharp relief that people have actually experienced setbacks in their health because they just decided, you know what, I'm not going to refill my prescription. This is too long, it's too annoying, I have too much work to do, and I've actually suffered from it. And I was wondering if this is something that you consider in your work, or is this something that your teams consider? Is that part of your thinking process when you know, try to improve patient access, really bettering health outcomes? Any one of you?
Normally, or in the past, no. But ironically, in the last year, our contact centers meet with the Physician Advisory Council on a monthly basis, and we go over telephony stats, et cetera. But we also go over our call dispositions and try to identify if there's anything we can do to help via the clinician's perspective. And this topic actually has come up where so many patients are calling to refill prescriptions or have prescription questions, et cetera, that we recently had a discussion where the physicians are going back and trying to identify why we're not synchronizing prescription refills for, let's say, patients with maintenance medications or chronic medications other than controlled substances for 90-day prescription with 4 refills. And so that would help reduce calls to the call center, so I can refocus those agents to calls that are coming in for scheduling, et cetera. And then also those patients then would be able to get their prescriptions refilled and not have to go without the medications or have further complications, as you stated, Ziv. So we are actually looking at that, but I think if we didn't partner with our physicians, we may not have thought about that. But because we are partnering with our physicians, these conversations are top of mind now.
Yeah.
Mona?
I think for us, we do think about it quite a bit, and we noticed that or realized, I don't know, that we required a visit for many routine prescriptions, such as birth control. That would, include a brand new prescription or even a renewal of of existing prescription. And sometimes those visits could be scheduled for several weeks or months, depending on the provider. So we started looking at how we can, fill some of these gaps. So we have started launching what we're calling really on-demand services around prescription renewals. So patient would go online, fill out a form, and then their request would be reviewed asynchronously. And within a couple of days, they would have their prescription. And so we were just really trying to remove some of those obstacles around the process and what we required. And it just didn't make sense in a lot of ways. So we are looking at how to fill those gaps, and that's one of the ways.
Great. So Jim, you have 2 decades on the front line of patient access. Where do you think the industry has been improving, and where do you think it's actually regressing? And before you answer that, and Mona, feel free to chime in as well. Would you say the average American patient is more or less satisfied with the support they receive from their healthcare providers compared to, say, a decade ago? Are we improving or are we regressing?
So I'm going to start with the positive because I'm a half glass full kind of guy.
As the balloon would indicate. Yes.
As the balloons would indicate. So from a positive perspective, the industry is absolutely improving. I mean, with AI coming out of every area, and especially in our industry. For example, we're seeing AI powered chatbots. Now we're calling conversational AI actual agents, chat agents. So they are able to answer questions in real time. They help reduce wait times. They help free up live agents to focus more on complex issues. So there is so much efficiency and improvement in our world that a couple decades ago never existed, or we never thought existed. I mean, workforce management alone, I used to have spreadsheets after spreadsheets trying to figure things out, where now everything is automated. So there's so much AI and machine learning. However, if I look at, instead of regression, I'll call it opportunity. Complex menus, endless loops, automatic call disconnects. That frustrates our patients and our callers. And I think it might be getting worse, or at least that's the perception I'm getting. For example, I noticed that on LinkedIn, there was a couple comments made about, oh, thank God you guys are talking about this topic. I tried to schedule an appointment. The office was closed, but it was during normal business hours. I then got connected to voicemail. The system hung up on me. I tried to call back. I had to maneuver through all these menus. And then jokingly, and I thought it was, pretty funny, someone responded, maybe you should have hired or tried Pony Express. And then the comment was, perhaps pigeons might be more economical. So it's funny, but at the same time, it's reality. These are, things that some of our callers are thinking. I thought you were going to flash a statistic out there for a second.
All out of statistics.
So I do think that is a regression. But I have to say, though, I recently had a conversation with an operational leader who was asking me very complex requests regarding a decentralized call center that would complicate the decision call trees. And I needed to make sure that they understood, the more complicated we make a system, the more questions the caller has to answer to get to the right location. And I have to say, we as call center leaders have to step up and provide invaluable guidance and support to these operational leaders to ensure that we're providing, seamless personal operations. If we don't, then we will continue seeing some of that regression.
Right. Mona, anything to add?
I completely agree with Jim. And the only thing I will add is I don't think we are regressing. I think things have improved a lot. I actually think the bar is just getting higher every year. So it may feel sometimes we are regressing with those amazing experiences that people are having in other industries, which I think were also accelerated during the pandemic. They can do all kinds of really great stuff when they're, dealing with their bank or their airline or shopping.
Yeah.
And they're seeing that and expecting that of every industry. So that bar is so much higher, and we've got to be able to keep raising our bar as well, and the capabilities that we offer people, so that they feel like they're getting a similar experience.
Yeah, I think it's actually a perfect segue to my next question, Mona. Prior to your, to your illustrious career in healthcare, you spent nearly a decade at Bank of America. Fun fact, given that unique perspective, right, in a completely different industry, in a very, very customer-centric industry, with, you know, the major banks fighting for every single account every single day, what do you believe healthcare can learn from the banking and financial sectors regarding engagement, experience, and satisfaction? What would you like to see crossover from, say, Bank of America to Intermountain Health?
Yeah, I think there are a lot of lessons that the healthcare industry can learn from financial services, especially in that digital space. And I will be clear, it was not easy back then when this focus on digital consumerism was, was taking hold, many years ago in financial services. And it is, I have a lot of deja vu experiences just hearing some of those similar questions that we asked, way back then, and that hesitation and wondering if people will actually use this or do they want this. So all those questions were happening back then. So I don't want it to appear that it was just so easy. It was still a change and a huge pivot. And but we should be there by now. So anyway, there's a lot of lessons. If I really think about just a couple of them to share. First, that complete and just unwavering focus on the consumer. Right. So I think it really wasn't until a few years ago that in healthcare we actually started using the word consumer. Right. It was always patient, which is great. Of course, we focus on the patient. But when you think about a consumer, you're thinking about somebody who maybe you don't have yet, or you really need to work hard to retain. It's not a given. And that is something that financial services was really focused on. Well, not focused on internal processes, not focused on all this complexity, not focused on all the regulations, because there's a lot of those in financial services as well. It was really focused on the consumer and how do we work within the constraints that we find ourselves to produce the best experience to attract and retain a consumer. Second, I think really taking a design thinking mentality that truly gets to the consumer need and builds solutions with them and for them. And I think we often make a lot of assumptions about what we think a patient wants, what we think a consumer wants. But when you actually watch their behavior and you ask them to engage and you ask them questions, probably 9 times out of 10, you were wrong. And if you just watch what they're doing, you can come up with solutions that will actually work for them. And additionally, some untapped needs as well. And then I think the last thing is really using data to help make decisions and for continuous improvements. When I was in financial services, we did not make any decision unless we had the data to back it up and really using that data to drive the decisions. As a public for-profit company, we wanted to absolutely make sure that every dollar we were spending on advertising was bringing in customers and was effective in doing so. So using data to make improvements, to understand what your consumers need, I think that's probably the third element that I think we can borrow.
So why aren't we there, right? You said you kind of feel like healthcare, the industry is sort of grappling now with issues that back in your Bank of America days were. So why does healthcare lag in this way when it comes to the patient experience, access, etc.? Jim, feel free, of course, to chime in.
Yeah, I mean, I do think that we're absolutely getting there, and we have made some major improvements. But I do think it's just been traditionally not the focus. The focus has been clinical excellence, also extremely important. Patient care, also extremely important, and making sure that we are safely and effectively running our business within all the regulations that are out there. And so I think it just hasn't been a focus because we've been focusing on those other things. But I do believe that as other industries have gotten ahead, that's putting the pressure on the expectation.
Jim?
Completely agree. And Mona said something that really resonates in healthcare, and I know with everybody else here, the healthcare sector is just slower to adopt technologies. First and foremost, because they're highly regulated. And so, for example, HIPAA makes it difficult to collect and pool healthcare data. It makes it difficult to use healthcare data to train AI models, like other industries are able to do. And then you have cybersecurity risks as well, to the point where we, at least at our organization, we require anyone who works with us to have SOC 2 and high trust certification. So it just puts it at a disadvantage compared to some of the other industries.
Sure. A lot of red tape, or more red tape. So Jim, you oversee access centers at Endeavor Health, and you've had the chance to refine and enhance processes over time. So I was wondering, what are some reoccurring challenges, really sticky challenges that keep coming up, and which of those do you feel are specific to Endeavor Health and your patient population and your location, and which of these challenges do you think are industry-wide issues?
So when I think Endeavor Health, I think of our situation where we have recently merged and acquired, and together we're now 9 hospitals in Illinois. That when you take a step back and look at it from a call center perspective, we have 4 telephony platforms. We have 3 instances of Epic. We have 4 websites. How do we expect our patients to communicate when there's all these different methods and it's not standardized across the system? And so I find that challenging, but we're working through it. We little by little, we are moving towards one telephony platform. We have a strategic project for one Epic. But that is a challenge. However, the most difficult challenge isn't necessarily Endeavor Health related, but I think more industry related, and that's the endless amount of communication and collaboration required to standardize all the processes and operationalize best practices that you see as more and more clinics, hospitals, health systems undergo mergers and acquisitions. And so constantly collaborating and communicating so that we can get to where we want to go without disrupting our businesses, and trying to streamline a safe, seamless, and personal experience for our customers, our consumers.
Speaking of mergers, Mona, in 2022, Intermountain merged with SCL Health, and you've led the charge in bringing all consumer digital within your digital services team. This has yielded impressive results, which we'll discuss shortly. But first, can you elaborate on the process? So Jim was talking about all of these moving parts. How did you consolidate so many moving parts in a pretty short time?
It seems like some days it seems like just yesterday we embarked on our merger, and other times it feels like it's been years. So it's been a really exciting experience, and I think there were really a lot of things that had to happen or be in place for it to work properly. So just as way of background, we had some of the digital pieces kind of sitting in marketing, may have been sitting in other areas within technology. And I think in order to bring those together, it certainly helped to have my specific career background in place. So my background spends many years in marketing. I sit in technology today, but spent much of my career in marketing communications, including digital marketing. So I understand how the space works. I understand what the goals are as a marketer. And because of this, I think my partners in marketing communications had confidence in my ability to manage those digital teams effectively, even though I sit in the tech organization. And I have personally found that having these competencies really sitting within technology allows us to touch the tech directly, make things happen much more quickly. So you think about, the patient portals and CRM and our website. We continue to have a very, very close relationship with the marketing and communications teams and our consumer experience teams. So that was critical. We work together all the time. We have a lot of meetings together. We sit on the same initiatives. So we work super closely together. We're just part of an extended family is how I see it. And I think, another thing is that our technology organization, Intermountain Health, is really viewed by enterprise leadership as a strategic asset, not just keeping the lights on. Of course, that's important too, solid foundations, but we directly influence and support the enterprise strategy, and are just a very specific piece of those enterprise initiatives. And then I think, the last thing maybe I'll mention is just, all the rest of managing a high performing team, an innovative team. We try to take a product management approach. And so we provide the expected outcomes and we empower the teams to give them the space to solve those hard problems continuously. So they're really not focused on project by project, because once the project's over, what happens? You just, abandon that product. But when you actually permanently own a product, every project is really just an improvement, and you keep moving forward. Your teams are empowered to always look at how they can improve the product that they're working on, whether it's the website or the patient portal. They're always doing research with our consumers. They are constantly taking all that information in so that we can deliver better and better experiences for our consumers. And I don't think you can do that if you have teams that are sort of order taking or just focused on getting the next project done.
Sure. And I mean, I think that, this is just a short list of your team's accomplishments. After just 1 year, we're talking about a 35% increase in patient likelihood to recommend Intermountain Health, an 85 reduction in call abandonment rate in your peaks region, and a 130% increase in NPS. And I imagine many of our audience members are, tuning in closer. How did you achieve these outcomes? What went into achieving these results? Was it really defining and finding very specific ways to achieve these specific results, or was it more of we are going to improve everything and these results were a byproduct of that?
Yeah, I think people may have questioned our sanity when we embarked upon some of the projects we did. But sure. I do think that it was sort of a perfect storm. We had the merger in place. Mm-hmm. So, that of course, is a catalyst for lots of changes, lots of replatforming. We also had a brand new brand. So we had a rebrand of the entire organization. And so we had to touch every space anyway as part of that. So I think from a tactical perspective, we launched a lot of new capabilities, enhanced existing capabilities in the digital and contact center space. For example, we completely rebuilt our website from scratch to be able to bring all of the regions together in one easy space. And so we used all our consumer research. We started from a blank slate. We were able to design something that worked really well. We also introduced our AI voice assistant in the contact center space, and that has really given people yet another option on how they interact with us. And for us, we don't want to force anybody into any experience. We want to provide options, whether it's the phone, website, patient portal, anything like that. Give them options to engage with us. And we also looked at what our agents were using too in contact center. So we built them a comprehensive agent desktop with a lot of real-time information, care gap information that they could use to help fulfill the needs of patients and consumers who were calling them. We also, looked at our online scheduling and expanded it in some regions to allow guest users, like they didn't have to have a portal account to do that. And we've made a lot of improvements in our patient portals just to make it as easy as possible for them to get their tasks done. So I think, we just kind of used what we were given, and we were given an opportunity to make a lot of changes, and we took it. And I think, from a team perspective, I'll just reiterate what I mentioned before. The teams have to be empowered to solve problems. They don't work well when you say, here's what has to be done, go do it. We give them expected outcomes. We give them what we seek to improve, and then let them figure it out using their expertise, using their understanding of consumer needs, using that feedback that they get constantly, and have them go do their best work. I think it's super important.
I mean, evidently it worked. I love that approach. Jim, Endeavor Health is, also I'd say a really a shining beacon of patient satisfaction. In the 2019 HCA HPS survey, Endeavor scored 78% in patient likelihood to recommend the system to friends and family, 6% above the national average, 7% above the Illinois state average. As really the head of Endeavor's contact center is often a patient's first interaction with a health system. What are the key metrics? What are the key KPIs and OKRs that you and your team obsessively track to deliver these results?
Ziv, as previously mentioned earlier, we meet monthly with our Physician Advisory Council and go over quite a bit of telephony metrics. But two metrics that stand out that we are very transparent with our entire organization and are displaying those metrics on our system scorecard, our average speed to answer, and then answer rate. The system scorecard is viewed by everyone in the organization, and then also reviewed by the executive team, and then a few other committees like the Access and Throughput Committee and Patient Experience Committee. Callers who experience long wait times often become frustrated and impatient, so it's crucial to monitor the average speed to answer consistently. A high ASA might indicate that the agents may lack training or knowledge, or suggest perhaps that we're understaffed. The answer rate in a call center reflects the total number of customers who are connected to an agent. This is the opposite of the abandonment rate. We flipped it so that it has more of a positive spin. And then, as you know, patients who abandon calls may not schedule to confirm appointments, which can lead to revenue loss, or worse yet, patients who abandon calls may delay seeking necessary medical attention, which can lead to health exacerbation of health conditions like we talked about earlier. If the answer rate decreases, it could mean that we need more agents. It could also result from, let's say, confusing processes like IVR that isn't routing calls well. But we also go beyond those two metrics. We dive into anything that we feel that may impact the big picture. The big picture being scheduling volumes, brand reputation, and patient loyalty.
Got it. And has putting that spin, what do you think has been the psychological effect of going away from a term like call abandonment rate to answer rate? What have you sort of noticed, how our data was, but also anecdotally?
So my team actually came up with that. They believe that to keep your mind in a positive state or half glass full, you need to do that. Or if you keep it in a negative state, then you're looking at things, glass half empty. You can also look at it, how you define your end state. Is it negative or positive? Are you aiming to have fewer failures? Like, are you aiming to have fewer complaints, incidents, errors, etc.? Or are you achieving success by increasing answer rate as a leading indicator to patient satisfaction, loyalty, increased revenue, etc.? So it's a flip that makes you think more positively.
Yeah, it's sort of replacing the stick with a carrot. I love that. So one final question for the two of you before we give the stage over to our audience members, and we will go back to the slides. I promise. I saw that request, and we will of course share the full report with every single one of you. How can system decision makers, all right, this is, I guess, the most high level question here. How can they rethink patient access? And Jim, you just gave a brilliant example of sort of like of a rethink, a reshifting of the mind to more positive metrics in order to stimulate results. And so how can patient access leaders rethink patient access to overcome these persistent friction points that are really, hitting the entire healthcare industry? And really, how do we bring healthcare up to par with other industries, which we also sort of talked about, even with the added red tapes and even more largely, what are we missing? And maybe now is actually a good time to go back to some of these slides. What are we missing? That 21%, and you can see my slides now, right? Okay, great. What are we missing? The 21% of patients forego refilling their prescriptions, or that 23% of patients never call to cancel their appointments. Why I feel, as someone who's really researching this field a lot, I feel like we keep hitting some of the same friction points. So yeah, I just talked a lot. What do you guys think?
Oh, such a simple question.
Go ahead, Mona.
Go. Yeah. What is the meaning of life, Mona?
I know. I feel world peace,
Yeah.
I feel like when I saw all of these statistics, which were very surprising and a bit sad, as I mentioned previously, I think we're missing that complete focus on the consumer. It's like, if we focused on the consumer and we watched their behavior, we listened to what they were telling us, I don't think we would have these problems, because we would hear that it's hard to do X and it's hard to do Y. So let's give some other options to be able to do that. And then I think, certainly we are in a very tight and difficult financial environment. All health systems are being constrained. And so when we bring things to the table for approval, obviously it has to improve the patient experience, has to improve consumer satisfaction. But all those things are also good for your organization. So if you're attracting more patients, if you are able to outreach properly to them to keep them healthier, if you're able to make it easy for them to make changes to their journey wherever they want, that's going to be a benefit for your organization. And I think that needs to be represented in the business cases. And ultimately, all this is just table stakes. It's sometimes frustrating to have to, really make a solid case for this stuff when it just has to happen. But we can do that. We can put together business cases to make all of this happen in such a way that will be beneficial for your patients and also beneficial for your organization.
Great. Jim?
So there is no magic bullet. I wish there was. And Mona, you touched upon this earlier about continuous improvement. But fine tuning and continuous improvement, I think, are very important key. And doing that with the patient in the center of those discussions. You can buy the most latest technology, tool, whatever is out there, and put it in. But automating broken processes only gets you more efficient broken processes. And so if you put it in and healthcare changes continuously, you have to stay on top of it. Otherwise, you're gonna be in the same boat that we are in today.
Got it. Great. Now I'd love to open it up to our audience members. So feel free to drop your questions in the chat. I actually got an email from Steve Rooks, who's a business advisor at Spring Fertility. And he couldn't make it, but he asked that we'll send him a recording. So hi, Steve. Steve asks, how important is providing patients with omnichannel access compared to limiting them to one or two channels, such as call or email? And I feel like that sort of touches, when is there merit to sometimes limiting access channels as opposed to opening it all up and you can, thoughts?
I love technology, and I think that the more we identify the channels of communication preferred by each patient, the better. So if you can operationalize all of it, I would do all of it, because then that way the patient has their way of communicating with you via chat, via conversational AI, via email, via SMS, via call, 24/7.
Right.
So why limit it? If possible. I'm not saying it's possible for everyone, but why not that be the magic bullet?
Sure. Mona?
Yeah, one of our key guiding principles in digital services is to give different options to engage with us, because not everybody will want a single or even two options. And many times people will use all of the different options depending on their needs. So yeah, the more the better.
Great. Greg from MHS Syndicate is asking, can you comment on whether it is easy or hard to make a business case to prioritize these types of digital projects for patient access? I think maybe, Mona, this is specifically to you. Greg, feel free to chime in if I'm right here. But can you provide examples of quick wins?
Yeah, I think that putting together business cases is always difficult. We really try to come to the table with very specific data to show what we're trying to achieve. And these days, it's not quite enough to just have, we will improve consumer satisfaction by this much, or we will improve our employee satisfaction by this much by giving them better tools to engage. we are really taking it one step further and saying, we believe that this new capability or this new piece of access will allow for additional, appointments scheduled, additional access. And there's certainly a financial value to that, and also retaining patients. So we do have those hard dollar items that are brought into our business case, along with some of maybe the qualitative types of things. We did put together some really interesting business cases for expanding online scheduling back in the day. And we've been able to achieve what we said we would achieve, which really allowed every provider to have an additional certain number of new appointments among new patients too every month. So that's just one example of how we've gotten things approved.
Great. I think we have time for like 2 more questions. So if anyone wants to go ahead, we have another question here. Thoughts on flexible routing with callback, chatback assist to allow the patient to indicate that they would like to talk to the agent they last interacted with to avoid the issue of having to repeat the inquiry. Jim?
We don't have this tool everywhere, but it's possible through a CRM tool technology, so you can see who last spoke with the patient and what that conversation was about. Seeing the entire patient journey, it's fantastic, and we're strategically planning on pushing that across our system. So it is possible, and we can do it today in one of our areas. We just need to continue to push that technology across the system.
Great. By the way, the report, you should be seeing it on your screen, a link, a button to download it. So for anyone who has requested, a question from Kirk. I hope that I've pronounced your name right. In terms of ROI, what type of digital engagement investments have had the best return in terms of experience, impact, or CSAT or NPS scores? What type of digital engagement initiatives have had the greatest impact experience? Anyone of you?
And hello, Kirk. I know Kirk. Good to see your question and your name. I think it's actually, it needs to be a combination of things. So we have seen great results from expanding online scheduling in itself. But if your other channels aren't keeping up, then you're going to miss something. So I would say any sort of self-service in the online scheduling space has certainly given probably the biggest lift. Also, just adding other types of channels that give people a choice to engage with us. The other thing that has been very effective is sort of this sense of guiding a patient through their journey. So not letting them have to think too hard about what the next step is, but automated anything, automated emails, automated outreach, information about care gaps that agents can speak about, sort of like what's the next thing that person needs to do, and make it super easy for them to do it. So I'd say probably those couple things.
Jim?
Agree everything that Mona said. Self-service is probably the number one area that I would put all my eggs in that basket, and making sure you have decision trees thought through so that it's easiest for the patient to schedule those appointments online or through MyChart or whatever EHR connection you have. Self-service is probably the greatest investment.
Yeah. And patients seem to agree. So we're all out of time, but I want to thank you both, Jim, Mona, for your time. This has been fascinating. Definitely a lot of lessons learned. and all lessons that I feel can be applied. Some of them are obviously longer processes, but some of them really just rethinking metrics and goals. I feel like is something that can be applied even tomorrow. And before we go, we want to announce that our virtual full day summit, Digital Front Door Day 2024, is coming back. We have a stacked panels of healthcare superstars to discuss the future of the digital front door in healthcare. And we hope to see you all there. Follow us on LinkedIn. There's going to be a lot of updates, a lot of posts about it, and we'd love to see you there. And you can see a little button at the bottom of the screen to register for the summit. We'd love to see you there. Thank you so much. This was awesome. Happy birthday, Liat. Jim, thanks for being such a sport with the balloons. Yeah, great seeing everyone. Thanks for joining us. Thanks.
Thank you.
Thanks.